The fight to end America's opioid crisis is being fought on a new battlefield, the courtroom. Federal judge in Cleveland is considering a case that could hold drug manufacturers responsible for damages brought about by opioid abuse. The Health Research Institute, Altarum, estimates healthcare expenses, lost wages, and lost tax revenues have cost the United States more than $1 trillion between 2001 and 2017, with an additional $500 billion projected by 2020. Last week, U.S. Surgeon General Dr. Jerome Adams and I explored the epidemic. In part 2 of my interview, we look at solutions. What responsibility do the pharmaceutical companies have in this crisis?
We all are to blame. As a physician, I was part of a culture that overprescribed. And pharmaceutical companies told us that these medications were not addictive. The law enforcement industry looked at this strictly as a moral and criminal problem and not as a public health issue. And the public demanded to have zero pain. They demanded opioids. And again, we're all part of this.
The American Dental Association just announced a new policy encouraging dentists to completely stop prescribing these drugs. Will that be effective?
I think one of the most important things we can do is have a conversation about appropriate pain management. I personally testified before Congress about how I got my wisdom teeth pulled and got sent home with 60 Percocet. Unfortunately, we know that 4 out of 5 heroin users got started with a prescription opioid, and that they say it's easier to get pills than it is to get beer.
Wow. No wonder the health crisis has had such an enormous impact on society, but it's also had an economic impact. And
Absolutely.
I'd like to talk about that. The Kaiser Family Foundation report says employers spent $2.6 billion to treat opioid addiction and overdoses in 2016, an 8-fold increase since 2004. What public-private partnerships could help address the crisis?
We know that healthier communities are more prosperous communities. And we also know that employers and communities a lot of times have tremendous influence. And so we really want employers to see this not just as a moral issue, but as an economic imperative that they help us address the opioid epidemic and overall community health.
There have been 2 public health crises in my life that actually were changed. One was smoking, and one was the use of seatbelts. And I believe that that was effective because of the advertising you saw. You saw the crash dummies. You see the pictures of people who have been affected by smoking. You see nicotine kills on cigarette packages. Showed the dangers associated with it. I noticed the National Safety Council has a campaign that is showing the faces of all of these people who have been affected. And there's another campaign, crisisnextdoor.gov,
yes, that's
that
the president's
also shows
initiative.
that. Right. So will that work?
We want to be careful that when we're doing an advertising campaign that we're not stigmatizing people. When we show the faces of addiction, we want to show the suburban soccer mom who had a C-section and was overprescribed. We want to show the high school quarterback who had an injury and ultimately went down an unfortunate pathway. Those are the faces of addiction. And I think if we can normalize addiction and substance misuse disorder, help folks understand that it exists in every community, then we will be successful. I think when you talk about smoking, what was particularly effective is that we targeted those ads at young people. As young as 6th grade, 5th grade, when I talk to folks, is when they're getting started down their pathways of substance misuse.
That's incredible. That's not too early, is what you're saying. You've been very open about your wife, Lacey, and her battle with melanoma.
Yes.
One of your Facebook posts, you write, "Thank you, prayer warriors. You are rock stars, and God is hearing our prayers." As a husband, as a medical doctor, the nation's Surgeon General, how important is prayer in this? And how important are faith-based organizations?
Well, number one, I believe in God. I believe in Jesus Christ as our Savior. And I try each and every day. Sometimes I fail, but I try each and every day to live in His image. And it's extremely important that we all realize there's a higher power at work here. There was a higher power that brought us to Washington, D.C. and away from our family support system, but in a place where Lacey could get treatment for her metastatic melanoma. We know we're not going to get through any trial in our life without prayer and without Christ. Now, in terms of Surgeon General and public health, we know that the faith-based community is in every community. I want to use them to help us lift up health.
Surgeon General Dr. Jerome Adams, thank you so much for joining us. Best of luck in combating this crisis.
Thank you, and thank you to all of your viewers. We will get there together.